I'm Dr. Anthony Malone. I'm one of the providers at Capital Care Developmental Pediatrics, and we're going to use this video to talk a little bit about autism. Autism is not a disease. It's a difference in how people think and act. So what is that difference that makes us think about autism? It really has to do with person-to-person connections. And of course, person-to-person connections start with communication. A person with autism has trouble communicating and also understanding communication. Some children just have less communication effort. Others are less responsive, don't use gestures, or don't know all the rules about conversation. And the other major concern about the difference in autism has to do with social interaction. A person with autism has trouble understanding their social world and responding to it. The typical back and forth of a relationship is just more difficult, and there's more difficulty with awareness of the social environment and what a child is supposed to do socially. These differences in communication and socialization really come about because of a different way of processing information and then making sense out of it. There are clear processing differences, not seeing the big picture, being less intuitive, having difficulty with symbolism. Those are some of the issues that come up very frequently. But of course, it's not just weaknesses. Thinking differently can give you great strengths, such as a laser focus, great memory, being curious, being sincere. But why is autism a concern? The world does need people who think differently, but it can also interfere with how you live. For example, we have to communicate with others. We have to be able to figure out our emotional needs, related to other people, and figure out our social connections. We have to be able to make reasonable decisions about life, and all those things can be a problem in autism. People talk about the spectrum of autism, and it tells us that autism can be a minor issue or not an issue, but it also can be quite serious. The official way of talking about autism spectrum includes 3 levels, level 3 being the most serious, level 1 being the least serious. But again, there's a level 0 requiring no support, and here's a list of a few people who've had issues in autism but have done very well. Where does an autism come from? Well, the original theory was that it was a psychological problem caused by bad parents. We know that's just not true. Our current understanding of autism is that it's a neurologic condition that's genetic in nature. And it's the genetic change that changes a person's brain and way of thinking that gives them a different way of processing information. So we think about autism as a difference in how a person thinks and how they act. That difference comes from a change in the wiring of the brain, and that change in wiring comes from mistaken genetic information or from the environment changing the genetic information. Those genetic differences are complicated in nature and are clearly influenced by the environment, such as exposures to air pollution. Those changes in the genetics change the wiring in the brain in very complex ways, and it's the change in the wiring that causes a person to act and think differently. It's also very clear those wiring changes can occur way before birth and certainly during infancy. So genetic concepts, first we know they do play a very important role, that they're complicated, that there are several hundred genes that can be involved, and that there's an important connection between genetics and the environment, such as toxins. An important genetic question is, could it occur again in my family? And clearly, the risk goes up when one child has autism. There's been a serious question about vaccines and whether they have any role in the causation of autism. And we have to say absolutely conclusively, there is no connection. We know this by the study of hundreds of thousands of children across the world, and we see vaccines have played no role. We can also ask, are there additional coexisting issues that sometimes happen with autism? And the answer is, just like with other conditions in life, it does occur with autism too. And one of the most common additional issues are problems paying attention. Also, there can be troubles with anxiety, acting out, emotional regulations, obsessions, coordination, and overreactions to sensory experiences. Currently, there's no medication for the treatment of autism. There are medications for behavior and difficulties with emotions, and many other supports should be used before consideration of medication. There are lots of popular alternative therapies that parents have used. Please just weigh the burden versus the benefit when you look at those things, and be cautious because claims are not the same as proof. For example, some inconclusive therapies include dietary supplements, special diets, oxytocin, hyperbaric oxygen, chelation, and many, many others. So what are some general things that parents can do to make things move in a positive direction? Well, we know with very strong evidence that early intervention makes a huge difference. So we want to find the best help possible and then use as much of it as we can. So learn more about autism from good sources. Use the preschool evidence-based interventions as much as you can. Encourage communication, play, and social skills. Find support for your family. Trust your instincts. You know your child better than anyone. If you're just getting started and your child is under 3, early intervention is really available for you. Call your local county office. For children 3 to 5, services will be covered by your school district. Call them. Many parents will use additional private providers through their insurance, such as applied behavioral analysis, speech, occupational therapy, physical therapy. You can find resources by looking on the internet for your area. You can do some of your own interventions, and some resources to prepare you include the CARD Center for Autism and Related Disabilities from SUNY Albany, the Center for Spectrum Services, and there are excellent self-help internet resources available for you also. If you are in New York State and your child has Medicaid, the Children's Health Home is an excellent opportunity for you. You can find those organizations online, and you can get quality information from some online sites, including the CDC and the Autism Society. And you can also get parent and family support from some excellent organizations, including Parent to Parent, the Autism Society, and the Upstate Autism Alliance. Thank you for watching this video. We hope that it's been helpful. You can find a list of resources posted on our website.